I'm going to start this evening by sharing just a little bit of personal history. My own personal journey regarding the health and welfare and success of children and how that success can be undermined by social and economic factors began almost 50 years ago on a cold winter night when I was an intern on call in Denver Children's Hospital. And about 2 a.m, a young woman came in labor. She'd been living on the streets. She was cold and anemic and malnourished. And she was also fully dilated. And I delivered the baby right there in the ER. Now, we called him Sam. He weighed less than 3 pounds. His lungs were not fully mature because of his prematurity. And I was part of his short life from the moment he was born until he died 2 days later. And I can still remember standing beside him in the final hour, knowing what was going to happen and feeling depressed and helpless. And he was a real tragic, fragile little figure. He was lying on a sheepskin. He had a mask over his nose and mouth that carried oxygen and warm mist through a green plastic tube. He seemed to be looking at me from a long way off. And he had his little fist was gripping that green plastic tube like he was trying to find something stable to hold on to, something to anchor him in this world. And as the hour wore on, he became more and more exhausted, and the skin between his ribs would pull in with every inhalation. And then he was gone. And there was nothing left but the emptiness of a soul departed and this soft hiss of the oxygen and the mist rising up from the mask. And I remember what a quiet death it was. There was no one else there but a nurse. No one else knew about Sam and his 2-day fight to live, never made the news or the evening report. It was an anonymous tragedy, but I've never forgot it, and it was no less tragic because it wasn't known. Now, Sam died in the intensive care unit of a modern hospital. He didn't die for lack of access to medical care. He died because he didn't have access to the basic social investments that are important for a healthy pregnancy. Investments that might have kept his mother off the streets, investments that would have given him the opportunity to live and to thrive and to contribute. Now, that was a long time before the study on adverse childhood experiences, so I suppose you could say we didn't know any better. But 3 decades later, this was still going on. I gave a speech in 2001 to the Portland City Club announcing the creation of the Oregon Children's Plan. And during that speech, I gave the story of Susan and Patty, also a true story. I've changed the names. Susan grew up in an abusive family with an alcoholic father. And when he began to sexually abuse her, she fled to the streets of Portland, where alone and homeless, looking for a place to belong, she continued to be victimized, started using alcohol herself, and became pregnant at the age of 17. With no prenatal care, with no emotional support, she continued to use drugs and alcohol during her pregnancy, and her daughter, Patty, like Sam, was born very prematurely and was diagnosed with fetal alcohol syndrome. Susan returned to the streets, where at the age of 19, any chance of living a life of contribution and fulfillment had all but evaporated. Patty became a ward of the state. She was diagnosed with multiple mental health disorders. Her first adoptive family gave her up because of behavioral problems, and she had 26 different foster placements before she was finally admitted to a residential mental facility. And all that happened before her 10th birthday. I know of no yardstick that can measure the depth of that tragedy. A young mother who will never know her daughter, a young woman who will grow up within the walls of an institution, and most of all, the tragedy of knowing that we could have prevented this, but we failed to do so. That was 20 years ago. Today we do know better, and our system is still focused largely on the consequences of neglect and abuse and addiction rather than on the root causes. And we see those consequences in our foster care system, we see them on the streets, we see them in the addiction crisis, and we see them in our overburdened behavioral health system. Now, to some people, these are just statistics, but to people in this room and to those directly involved, these are human tragedies. No less tragic because they are anonymous. And these tragedies play out every day across our state and across this wealthy nation. And with every anonymous tragedy that could have been prevented, we become less as a society, and we lose a little bit more of the soul of our community. This is not the story of putting our children first. This is the story of dedicated individuals and organizations that work day and night to undo the damage that's been done by adverse experience and trauma much earlier in these children's lives. We need to write a new story. We need to write a new chapter at any rate, and that's what I want to challenge you to do this evening. Let's write the story of how we don't have to wait and treat these problems on the back end. Let's write the story of how we exercised our power as a community and prevented these outcomes in the first place by addressing the conditions of injustice that were so starkly revealed by the pandemic. Let's write the story of how we secured our future by ensuring that every child and family has an equitable opportunity to succeed here in the state of Oregon. I want to be a part of that story. So as we take pen in hand and begin to write the new story of Oregon children and families, let's review for a moment what we know. We know all about the social determinants of health, and we know that one of the most powerful determinants that can undermine the success of a child is being born in a family under stress. And we know that two of the most powerful factors that create family stress and instability are racism and poverty. We're all familiar with the Adverse Childhood Experience Study, which shows the almost linear relationship between the level of traumatic stress in childhood and poor behavioral, mental, and physical outcomes later in life. And we also know that stress and malnutrition, both before conception and during pregnancy, can actually alter the genetic expression in the infant, increasing their likelihood for emotional problems and behavioral disorders and learning disabilities later in life, thus passing the factors that undermine child success from generation to generation. So what does this information tell us? It tells us that in order to break this generational cycle of poverty, we've got to address these factors that we are very well aware of. We need to strike at the root causes, which occur very, very early, even before conception. It requires a holistic strategy that recognizes that children exist in an ecosystem that includes their family and their community, both of which have to be integrated into any successful solution. And it requires recognizing that the earlier we can intervene, the more successful we're going to be. It's not unlike an airplane on a long cross-country trip that's being constantly taken off course by headwinds and weather and other factors. So on all long flights, there are a set of waypoints programmed in so that the crew can make course adjustments periodically to make sure the plane arrives there at its destination. So imagine for a second a plane on a flight from Portland to New York, and it's a degree off to the north when it leaves the runway at PDX. If nothing is done, it's going to end up somewhere north of Montreal. And once we know the plane's off course, it's a lot easier to correct that over Pendleton than over Chicago. And at some point, the plane is so far off course that it can't turn hard enough to get to its destination. Well, children also have waypoints in the flight of their development that tell us whether or not those children are on course. There are certain physical, social, and emotional developmental waypoints in the early years. Kindergarten readiness, reading at level in the 3rd grade, on track to graduate in the 9th grade, etc. These waypoints are a continuum in the development of our children, and the earlier we can intervene in the life arc of a child who's heading off course, the more successful we're going to be. The more likely it is that that child is going to reach their full health potential, their full life potential, and the less costly it's going to be, both in terms of the initial investment and avoided costs downstream. What we're talking about here is primary prevention. What we're talking about is identifying and addressing the root causes of adverse childhood experiences and trauma very, very early in the first 1,000 days of life, from conception to the age 2. Well, this brings to mind sort of that parable of the fishermen that see a baby floating by in the river, and they run in and rescue the baby. And then 2 more babies float by, and then a 3rd, and they rescue them as well. But the babies keep coming. More and more babies keep floating down the river, and the fishermen are running in and out, rescuing these babies. And finally, one fisherman stops and starts running upstream. And the other fisherman says, "Well, where are you going? You have to stay here and help me pull the babies out of the water." And the fisherman says, well, I'm going to go find who's throwing him in the first place. It's right there in the first 1,000 days of life that the babies are falling into the water. And most of what we do after that is try to rescue them. And it's important work. It's work that has to be done. But the fact is that unless we can reduce the number of babies coming down the river, we're going to get further and further behind. And we're going to see a steady increase in the number of anonymous tragedies like Sam and Susan and Patty. In fact, it's this steady flow of traumatized children into our system that explains in large part why we can show positive results within given programs and different organizations, but the opportunity gap is widening across the population. So turning that around requires two things. First, it requires, I think I've got a little slide on this here, it requires long-term stable funding in the first 1,000 days of life. And secondly, it requires a community-based delivery system that is intentionally designed to break the generational cycle of trauma and adverse experience by striking at its root causes, by striking at the conditions of injustice that exist before conception, during pregnancy, in the first few years of life. So let's start briefly with funding. I think every program that works in that child and family space is underfunded. In fact, we're here tonight to raise money for an organization so it can expand its services. The reason these programs are underfunded is because there's an increasing demand for the services they provide, and that's part of the problem. Consider for a minute that Oregon has the dubious distinction of having the second highest overall addiction rate in the nation. I think we're highest in terms of opioid addiction, and we are dead last in terms of access to treatment. So what does that mean? It means that the demand for these limited public resources is going to continue to increase. And historically, primary prevention loses out to acute interventions. And part of that's due to the fact that the positive return on these investments doesn't show up immediately. But the legislature tends to fund things that are compelling and immediate and visible. Right? So in other words, the political system tends to fund acute interventions rather than investments that could prevent those interventions in the first place. So if you're a legislator and you're faced with the choice of funding prenatal care for thousands of women or resuscitating 500-gram infants in the neonatal intensive care unit, the political and emotional imperative will always take money out of the community and put it into the hospital. And that's because to the legislatures or to the political system, those neonates are really visible. They're right there. They're compelling. Whereas the women who need prenatal care are anonymous and therefore invisible to the political system. That's pretty much what happened to Sam and his mother. That means that our challenge, and I would argue our responsibility, is to give voice to the voiceless and make visible those who are currently unseen by demanding that primary prevention become a much higher priority in the Oregon budget process. Now, that's no easy task because it requires a group of diverse stakeholders and those who represent them to come together to elevate the importance of and sustain the investments in these early years, right? But all of those organizations are also fighting for their own share of the budget pie each 2 years. But if you think about it, successfully addressing the root causes of childhood trauma and adverse experience is not just an education issue or a healthcare issue. It's a social justice issue. It's an economic independence issue. It's a public safety issue. It's an issue of social stability. In other words, the responsibility to ensure that all of our children have an equitable opportunity to succeed is a shared responsibility that all of us need to shoulder. Now, all the money in the world is not going to break the generational cycle of ACEs unless it runs through an integrated, community-based delivery system that actually get the right services and supports and treatments and protective factors to the right children and families at the right time, in the right amount, and long enough to make a difference, right? We know that the range of services that a given child or their family may need is extensive, but we know it would include things like nutrition, affordable housing, affordable child care, transportation, access to treatment for behavioral health and substance abuse disorders, job training, employment, et cetera, right? We also know, and this is where the herding cats part comes in, we also know that in every community there are dozens, if not scores, of individual agencies and programs and institutions and organizations providing these services. The problem is that sometimes they're only dealing with one or two risk factors and not necessarily as a constellation. They may not be coordinated or integrated. They may compete with one another for the same revenue sources. There may or may not be coordinated handoffs from one organization and one program to the next. So children and families wander through this fragmented landscape looking for help, rather than having the services and interventions and supports and protective factors follow that child and their family across the community and over time. As I mentioned earlier, we can show great positive results within individual programs and organizations, but we are not narrowing the opportunity gap across the entire population, right? We're winning the battle but losing the war. In a real sense, we are program rich and system poor. We're failing the community one success at a time. I'm not saying we need a new organization or a new program. We've got plenty of great programs and organizations, this being an example, that are doing wonderful things and making a positive impact in the lives of individual children and their families every day. What we need is some kind of new coordinating or governance entity that can reach far upstream, almost to conception, identify the factors that are likely to take that child and their family off course, aggregate the supports and interventions and protective factors that are necessary to mitigate or prevent those things from happening, then ensure that they follow that child and their family over time and across the community. That delivery system does not currently exist. It doesn't exist. So we have to imagine it. And to imagine it, we have to have the courage to look beyond our individual organizational missions and service profiles and ask, what can I do to prevent or at least significantly reduce the need for the very services I exist to provide? How can I put myself out of business? Let me say that again. What can I do to reduce the need for the very services I exist to provide? Imagine with me for just a moment a world without the need for foster care. Imagine a world where children and families aren't living on the street for lack of affordable housing. Imagine a world without abuse and neglect and addiction. And imagine how much better that world would be for our children and how much stronger we would be as a community if we were actually able to build it, right? That's a big idea. It is a big idea, but this is a big problem and we're not solving it. So it's going to require some big ideas to actually get it done. I'm dating myself a bit here, but some of you may remember the day in 1962 when President Kennedy challenged the nation to go to the moon. And I want to read you just one paragraph in that speech, which I still find inspiring today. We shall send to the moon, 240,000 miles away, a giant rocket made of new metal alloys, some of which have not yet been invented, capable of standing heat and stresses several times more than have ever been experienced, on an untried mission to an unknown celestial body, and then return it safely to Earth, re-entering the atmosphere at speeds of over 25,000 miles an hour, causing heat about half that of the temperature of the sun, and do all this, and do it right, and do it before the decade is out. What an incredible leap of imagination. Kennedy didn't give us a roadmap, he gave us a destination, and all of us wanted to get there. And what he did is he changed the debate from where we want to go to how we get there. And in so doing, he engaged and inspired the innovation and passion and creativity of the nation in common cause. And we did it. We got to the moon in 7 years. We did it because we imagined it. We did it because the story preceded the accomplishment. The new story, the new Oregon story of children and families, likewise, needs to start with imagination. We need to imagine what that missing delivery model looks like. A child success model, if you will, that can break the generational cycle of trauma and adverse childhood experiences by striking at its root causes in the first 1,000 days of life. Impossible? I don't think so. For the past 3 years, leaders in education and healthcare in Oregon have come together to explore innovative ways to meet the needs of children and families served by these two powerful sectors. And one of the things that came out of that collaboration is the Oregon Health and Education Collaborative, which is in the process of setting up 4 design projects around the state that will ask this question. If anything were possible, if we weren't constrained by resources, current structures, laws, and regulations, what would it take to ensure that every child and family in that community has an equitable opportunity to succeed. These are not demonstration projects, but blue sky design efforts to identify what the key factors of that system would look like, how much it would cost to capitalize it for 5 years, and the kind of new community-based workforce that would be necessary to implement it. In short, the goal is a moonshot conceptual design to create the blueprint for a child success model. Now, as you think about what that would mean for our children, if we could actually be successful in that endeavor, let me leave you with the words of Albert Camus by paraphrasing something that he wrote in 1948. Perhaps we cannot prevent this world from being a world in which children are harmed, but we can reduce the number of harmed children. And if you don't help us, who else in the world will help us do this? Tonight, I'm asking you to help create and imagine a powerful new coalition for primary prevention and success. It is a big idea, but it is not an impossible one. In 1962, we had no idea how to go to the moon. We didn't have the technology, we didn't have the engineering, we didn't even have the raw materials. We had to invent some of them. Today, we know the causes of childhood trauma and adverse experience. We know how to mitigate and prevent them. And we can identify the children and families who need those services, who need that help, by zip code, by neighborhood, and almost down to the household. So let me ask you this. If we could go to the moon in 7 years, given all that we didn't know in 1962, surely, given all that we know today, in the same period of time, by 2030, 7 years from now, we should be able to reach a point, a destination in this state where zip code and race and ethnicity and language no longer are predictors of your success or lack of success. In Oregon, where every child, in fact, has an equitable opportunity to succeed. This is not a challenge of technology. This is a challenge of political will and a challenge of human compassion. And we are limited only by the horizon of our imagination and by the depth of our commitment to one another and the generations of children as yet unborn. And this is not nearly as difficult as going to the moon. We can do this. And why don't we start tonight? Thank you.